physicians lack compassion for their patients? Find out on Medical Economics.
Physicians are under a lot of pressure today to see more and more patients, to do more and more documentation. There's more administrative duties, there's more regulatory stuff that they need to take care of, and that's causing them to become task-oriented. I know in my practice, sometimes I get so caught up in seeing patients that I become task-oriented instead of patient-oriented.
Do physicians lack compassion for their patients? Patient communication expert Dr. Anthony Orsini recently conducted a survey asking patients if they have ever experienced a lack of compassion when speaking with a physician. 71% said yes. In addition, another 73% said they always or often felt rushed by their doctor. It's no surprise that physicians feel rushed in today's complex and hectic healthcare system. And no one disputes that physicians do, in fact, feel compassion for their patients. But then, why this disconnect? How can physicians learn to bridge this compassion gap with their patients? Today, I'm joined by Dr. Orsini to discuss ways physicians and patients can reconnect. Dr. Orsini, thanks for sitting down with us today. What does compassion mean to you in the context of treating patients?
Well, compassion literally means, from its Latin root, to suffer with. And medicine at its core is a human-to-human interaction. It's about skilled professionals who feel the pain of someone else and want to relieve that pain and suffering.
Did you find it surprising in your recent survey that most patients felt a lack of compassion from their physicians?
The results didn't surprise me. I've been teaching communication to healthcare professionals for decades. And I know how much they struggle with conveying that compassion. I was a little surprised about how high the number was, though.
What's the difference between feeling compassion and conveying compassion?
Well, by the very nature of why physicians chose medicine in the first place, I believe that the majority of physicians are very compassionate people, but it's conveying that compassion that they often struggle with. For multiple reasons, physicians get caught up in the day-to-day activities of medicine and find it very hard to convey that compassion, or at least have it, patients don't feel that compassion from them. I think it is getting worse, but we're starting to put some more and more processes in to teach physicians how to cope with the demands and to start to put some more training programs into communication. It's something not taught in medical school or residency at this point.
What trends do you think are contributing to this compassion gap?
Physicians are under a lot of pressure today to see more and more patients, to do more and more documentation. There's more administrative duties, there's more regulatory stuff that they need to take care of, and that's causing them to become task-oriented. I know in my practice, sometimes I get so caught up in seeing patients that I become task-oriented instead of patient-oriented. And so we need to remember that medicine is all about that human connection.
Obviously, not every physician has an outgoing personality. What advice do you have for more reserved physicians?
I don't think you need an outgoing personality to form that connection with the patient. There's a few words or phrases that we can teach physicians on how to build that connection very, very quickly. There's certain nonverbal communication techniques that can tell a patient that you care and show them that the compassion that you have and make them feel that compassion.
A big topic in recent years is unconscious bias. I'm just wondering how you think that this impacts the compassion gap.
So communication at its very basis is about building rapport, and rapport is about finding commonality. I think regardless of cultural differences, regardless of our socioeconomic backgrounds, there's something that we can find common with one another, with everyone. And so if we can find that commonality, we can then begin to build that relationship. It could be that we both have children and one of them's a teenager. It could be that we both follow the same athletic team or like to read. It doesn't take very long to find commonality between one person and another. Once that starts, then the physician becomes a genuine person. The patient doesn't see you as a person, as just a doctor. The patient sees you as Dr. Orsini with 3 children. and likes to follow the Yankees. Once that happens, that rapport is there, the relationship is there, and we could really minimize that any kind of bias that exists.
What role, if any, do you think physician burnout plays in this?
For centuries, physicians have been taught that the way to limit burnout is to not feel emotion and to keep your distance from patients. We're learning more and more that the exact opposite is actually true. That when we feel emotion, we connect with our patients. It's been said that when humans act contrary to their core beliefs and values, that increases depression and burnout. And since physicians in general want to help and cure people, when we don't act and make that connection with our patients and try to stay distant, it actually affects us adversely and causes that lack of compassion. And so the way to fix this is to actually remind physicians that it's okay to feel. And once you can do that, you'll limit burnout.
You know, physicians are really busy and are interacting with dozens of patients every day. What advice do you have for physicians to show compassion despite their busy schedules?
I think what most patients really want is the relationship, and they want to make that connection. So simple techniques that we can teach physicians, such as sitting down and giving them your undivided attention, listening to them. The average time a doctor interrupts a patient is 11 seconds, and that's incredible. So sit down, give your patient your undivided attention, don't multitask, don't type into electronic health record at the same time they're speaking, because the patient feels that. And so doing those two simple things can go a long way in building a relationship.
Is there a particular strategy or training that physicians can use to show more compassion with their patients?
We spend a lot of time and a lot of money teaching young physicians the medicine and how to do skilled and difficult procedures, but we spend very little time teaching them how to communicate. And we need to put more programs in place to teach them how to communicate and build that connection. And so I think healthcare organizations in general need to train everyone, from the receptionist to the security guard to the nurse to the doctor, what healthcare is all about and how to communicate.